Sepsis is a major problem. It's very common. It's one of the key issues that leads to mortality and morbidity in patients that we see.
50% of patients who do not receive antibiotics in the first hour will not live.
I mean, it's projected that in the next 30 years, like 3 decades, that antibiotic resistance is going to be more predominant than cancer. More people will die from antibiotic resistance than cancer.
Typically, we thought of sepsis as, a patient comes in to the hospital or the emergency department and they're critically ill, low blood pressure, high heart rate, high fever, literally on the brink of death.
Generally speaking, just your body's response to an infection that's severe enough.
Baptist, system-wide, developed sepsis order sets, and we really had to focus on using those.
So whenever anybody comes in the door that triggers it, it focuses everyone to improve patient outcomes.
And then acting quickly on those patients, getting blood cultures, giving fluid for resuscitation, also giving antibiotics within 3 hours was the goal, and also fluid resuscitation within 3 hours.
It's not that all these things weren't being done, it's just a question of how fast they're done and in what order they're done.
It takes a lot of different disciplines. It takes laboratory, it takes pharmacy, nursing, physicians, all working together. Then we added in procalcitonin, which was an innovative tool.
It takes a village to combat sepsis. For us, entering the ED was an integral part of the whole process of treating those patients that are possibly septic. And so we always have collected blood cultures on them, but we implemented procalcitonin as another serial marker to hopefully help determine whether or not this is a true bacterial infection or something that's viral that doesn't require hospitalization.
Well, I think the first thing we did simply emphasis, realizing its importance and putting energy toward it, focusing toward it. After that, in the process of how do we improve things, it involved everybody, from lab to pharmacy to nursing to physicians.
Our provider's goal is to respond quickly and to treat it just as timely as heart attacks and strokes and just as emergently.
Procalcitonin just really helps promote responsible use of antibiotics.
Procalcitonin as a test is quite expensive, and we had to focus a different route in our business case to support the need to have it incorporated. And us using it as a serial marker has definitely decreased our length of stay on those sepsis patients.
And using those order sets more frequently really helped identify those patients and help us treat them better.
It's mainly doing the things that we know help patients and doing them, as intentionally and effectively as we can.